Hello, everyone. This is Dr. Amigues, your friendly rheumatologist from Unabridged MD. So I had the pleasure and the honor of being a guest on Chef AJ YouTube Live very recently, and it was a really awesome interview. It lasted more than an hour, and so there was so many good pieces of information. I talked a little bit about my own health journey, and then we talked about optimal nutrition in patients with inflammatory arthritis. And then ultimately, we also did a lot of Q&As, and I answered some questions from the audience. And I thought it was such an interesting interview that we would use this and put it for our Unabridged MD podcast. So we're going to do 3 episodes with it. You can also watch the whole thing on YouTube. If you just look at Dr. Amigues, Amigues, Chef AJ, you will see that interview. And otherwise, you can just listen here and watch here. And you should absolutely check Chef AJ online. So she has this YouTube video that has over 200,000 followers. She is vegan, oil-free, salt-free, sugar-free. And she brings on her show many interesting people, and it was really cool to be interviewed there. So I hope you enjoy it. And again, this is going to be a 3-part series, and enjoy. Take care. Bye-bye.
You know, when I used to live in LA, I still have the dog, and we did pet therapy at a cancer treatment center. And while the people were getting their infusions, they would come around with a lunch cart, and they'd have a choice. It was on white bread. They could have a roast beef sandwich, a ham sandwich, a cheese sandwich. They had their choice of chips and their choice of soda, because they just didn't believe that what they ate mattered at all.
Like the worst. Like it's literally the worst diet, right? Yeah. I think it doesn't cost money as much to do this type of diet versus a whole food plant-based. Yeah, it's so sad because now it's clear. It's so clear. What you eat is what you put into your body is so important. And like processed food in the US is so processed. Like processed food in France is not as processed as here. I can eat bread in France and I will have no GI issues, no problem. I eat bread here and I literally have GI issues.
Yeah, I've heard that a lot in all of Europe too. I've heard that.
Yeah, it's so weird. It's super annoying. So what I did is sometimes when I want to make bread, I order French flour and then I make my own bread. It works. But, I try not to do that too often anyway, because I should not have too much bread anyway. But, sometimes you want bread. But it is very funny. But yeah, so, in terms of the diet, like what I can, so I'm a rheumatologist. So I took my cancer journey and then I was like, okay, this is what I've done. Is there research behind all of those things that I've done? And I started looking at the research behind the whole food plant-based diet because once you're better, you're like, okay, do I continue this whole food plant-based diet or do I go back to eating easier food, right? Like, will I eat a burger? Will I eat, oh gosh, like the food that you just described from the hospital? That's like awful. And so that's the funny part is like, right, like when you start seeing that your fridge looks so much nicer and inviting because it has like red and purple and green and, like you're like, wow, like my fridge looks beautiful right now, thanks to this whole food plant-based. Whereas before it was just like, packaged, like nothing, all white or sad. And so the rheumatologic disorders, like when I looked at the research behind the whole food plant-based diet, I think that there's a lot of things that we have to take into consideration. The number one, so this is important. So number one, both in cancer and in rheumatologic disorder, we know that being overweight and having fat tissue leads to flares and leads to cancer. So there is like a study that came after my diagnosis where clearly women who were overweight and obese had more risk of breast cancer recurrence. I mean, like, and so people were like, well, the BMI doesn't mean anything. And you're like, well, it doesn't matter to me. Like, the truth is that that's the study. That's what they did. They looked at the BMI. in rheumatology, what's really cool is that we actually look at the fat tissue. We can actually look at the fat, look at how much fat you have. And there has been studies, including some from my mentors at Columbia University, where they looked at the fat tissue and they saw that the more fat tissue you have, the adipose tissue, the more risk, number one, you have more risk of developing rheumatoid arthritis and psoriatic arthritis. Number two, you have more risk of having flare and worse, and a more severe condition, more severe disease because of this fat tissue. So then you're like, okay, number one, definitely we need to exercise and we need to have a diet that's going to have me have less fat tissue. And it's not because you look good, you don't look good. I mean, I think that people of all shapes are absolutely gorgeous, and that's not what it is, but it's really like, if you could prevent your rheumatoid arthritis because you know that in your family you have more rheumatoid arthritis, if you can prevent psoriatic arthritis flare by just making sure that you lose some of this fat tissue, that is worth it. And then you start looking at, okay, so in the diet, like what have we showed in rheumatology? It's really hard to do a study on diet, but it has been done many, many, many times. And some of the best one follow, so it's actually kind of cool. They follow this cohort of nurses from, I think it's Boston. I mean, I'm sure it's Boston. I think it's Birmingham or Harvard, or maybe both actually. But basically they follow those nurses and they look at them, and then they look, okay, who has gotten, so different type of disease, but in this case, who has gotten rheumatoid arthritis, and then they ask them to tell us about their diet. And what they found is that like in different studies, so this one, other ones, it looks like red meat or processed meat can actually be associated with rheumatoid arthritis. So like, right, like it's almost like the plot thickens. You're like, okay, processed food. Oh my, and I forgot to mention, processed food absolutely linked to rheumatoid arthritis, to cancer, as well as psoriatic arthritis and so on. So basically, and cardiovascular disease, right? So like I can talk as a rheumatologist because that's what I look, that's what I study, but I can also tell you, if you do this, then you're also preventing all of those other things, right? And so you want to try to decrease anything that's packaged, anything that's processed, anything that has sugar. Corn sugar is everywhere here. I don't know why. I mean, I kind of know why. It's addictive. And then you want to decrease the amount of red meat you have. And sometimes like people are like, are you kidding? Like, I'm from Texas. I eat red meat. That's like my thing. I love this. And they're like, you can still eat, but if you're going to eat meat, then let it be the best meat on earth. And also like maybe like every 6 months, go to a steakhouse and indulge every 6 months. Just don't eat it every day. And I think like by knowing that you have this possibility of eating, here and there, maybe at first they're like, I'll tell my patients like, try once a week at first, then can you make it once a month? Can you make it once a 6 month? And very often it does work. So that's like the really thing that's really cool. There are some good news.
Can I ask you? You weren't overweight though, is that correct?
I was, per BMI, I was a little overweight, but it didn't look, because I'm very hourglass shaped. And so it didn't look, my waist was very tiny, my hips were very large. By BMI, I think my BMI was 26. So I was technically overweight. But it wasn't so, and no one would have said that I was overweight. Yeah.
Yeah. Interesting. Yeah. Well, you talk about, I mean, as a rheumatologist, isn't the root of pretty much everything inflammation?
Yeah, totally. Everything. But the truth is that now we know that cancer is an inflammatory condition. We know that cardiovascular disease is an inflammatory condition. So then it's like, okay, probably, I mean, we think that probably every single condition is inflammatory. It's just that in rheumatology, it's more obvious.
Yeah.
But like, for example, I did a study, I researched this in patients with rheumatoid arthritis. We looked at their heart and we did PET scan. And we didn't, they didn't have any cardiovascular disease because they would have been like, we would not have included them. And so we look at the heart of patients with rheumatoid arthritis who did not have heart disease. And we find that like in close to 40% of them, they had inflammation of the heart. So and then if you were to give them treatment and help them, then we saw that the inflammation was related to their disease activity. So inflammation causes harm everywhere in your body. Once you have inflammation, you can have issues in your whole body. And the truth is that, yes, we have medications, but there's also like a choice in what you can put inside of you. And that's why this is why I love you, because I love food. I love food. And so I didn't want to choose my food. I was like, I want to eat proper food. I want to eat something that's good. But then you discover new food, and then you discover that it doesn't have to always be processed meat. And it can be like, I don't know. I mean, I just discovered like incredible recipe that were vegetarian, and then you're like, oh my gosh, this is so good. I will eat vegetarian every day. I have no problem as long as it's good. And then you eat this and you're like, I know that my body is thanking me right now.
Yeah, that's wonderful. There's a question from a live viewer named Susanna. What do you think about soy, tofu, tempeh, soy milk, edamame? We have a wonderful plant-based doctor of PCRM, Dr. Neil Barnard, that really recommends it because a lot of people think it's bad.
Yeah, I mean, I love it. So you have to see, you come from a place like a lot of your audience, Chef AJ, are actually already plant-based diets. So they can go into more details and more like, granular, and really go and go very strict. But for my patients, the vast majority of time, they have a SAD diet, the standard American diet that you were just describing earlier, right? And so if eating the soy-based food is like a first pathway towards eating less processed meat, like a less processed food, then that's like a huge win. I personally love tofu, tempeh, and all of those things, so then I eat them. But I think like everything, it's a question of moderation. And in terms of rheumatologic disorder, if that's the question, like there is no, I don't think that we have studies. I have not seen them, the studies about this in rheumatologic disorder. So I would say that. The other thing, so that's like the other thing, and I didn't mention that, but I want to mention it's super important to me. When you try something and it works for you, it doesn't matter what the science is saying, because what works for you, it's what works for you. If individually, when you eat soy, it doesn't make you feel good, then soy doesn't make you feel good. And that's it. And you don't need the approval of a physician to tell you that, oh, yes, you're right or you're wrong. And that reminds me of more than 20 years ago, one of my friends was telling me, when I eat dairy, I develop tendinitis, inflammation of a tendon. Or no, she said that. And then at first we were like, oh yeah, this is BS, like it's not true. But then yeah, there is some evidence now that some patients develop flare when they eat dairy. So that was the first thing. Second thing, she tells me, the same friend, she's like, oh, when I have inflammation in my gum, I develop also again the tendinitis. And I was like, that's really interesting. And then what do they find? Like what other researcher found, and now it's super well accepted, recognized, is that there are, gingivitis, inflammation of the gingiva, like of the gums, can lead to rheumatoid arthritis. I mean, when you as a person discover something for you, it is real. I really wanted to share that. So when it comes to the soy, the tempeh, and all this, like I think you just try and see what you think about it. But there's no hard data right now in nutrition, like in rheumatology, that I know of at least.
Thank you. What condition do you mostly see in your practice?
So inflammatory condition mostly. So rheumatoid arthritis, psoriatic arthritis, lupus, gout, ankylosing spondylitis, inflammatory back pain. And then I also do a lot of diagnostic because I'm like Dr. House without the, no, I think I'm Dr. House without the attitude, or another one. I think that's the joke. But yeah, so I love diagnosing patients. Like I really like, I think that that's one of my zone of genius, is that I can come after 10 other rheumatologists and other specialists, and I will make the proper diagnosis, and I will get my patients on the path of the proper treatment. So that's, that's what I do.
Marcia's saying, well, what is the treatment for gout?
Oh, really? That's a cool one. Okay, thank you. Thank you for asking this. So gout, basically, it's related to uric acid. So there's too much uric acid in your body. And so either because you're eating too much, you're eating too much purine. So that's what, and then it degrades into uric acid. So that's usually in high protein, like animal protein products. So like if you're eating a lot of seafood, or if you're eating a lot of red meat, you're going to have more risk of having gout. And or you have not enough excretion of this uric acid. So you have too much uric acid. So the goal of gout treatment is to decrease the uric acid. You can do this with a diet. And very often we need to help you with medication, which is called the first line is called allopurinol. So we decrease the uric acid. The thing that a lot of people don't understand, even in medicine, is that as you're coming down of your uric acid, you may develop flare. And so as long as you're coming down of your uric acid and we have to adjust the dose of allopurinol, we recommend that you're also on colchicine. And colchicine is not nephrotoxic, which is good, right? So you're going to decrease the uric acid with the allopurinol. As you're increasing the dose of allopurinol, you're staying on the colchicine. And then at one point, you're at goal of your uric acid, and you haven't had any more flares. And that is when you can stop after 4 to 6 months. You can stop the colchicine and just live with just your allopurinol. And then that's what I tell my patients, right? Once you're in perfect remission and you're doing really well and your uric acid is really at goal, then what we can do is that we can try to decrease the allopurinol, because maybe you have a new diet and maybe you're doing well and so on, and we can see how you're doing. And we can just, look at the uric acid.
It's interesting for all the people and even doctors, because they didn't have much nutrition, if any, in medical school, that believe that diet doesn't matter in some of these conditions. I used to work at a place called the True North Health Center in Santa Rosa. It's a medically supervised therapeutic water-only fasting center. And if diet doesn't matter, then why, when they withhold all food and just give patients water with these inflammatory conditions that they would see a rheumatologist for, they all get well?
Yeah. Oh, I'm absolutely certain that diet plays a role in everything. It's just so hard to prove. So hard to prove. I had a long training in nutrition when I was in France, but it wasn't about what we eat. It was like how many calories you're supposed to eat, how to count the calories. Like, why did I need to learn how to count the calories? I still don't understand. So how to count the calories and how to put a TPN, which is like, if you cannot eat through your mouth, then how can you, like, to make sure that you're going to get enough nutrition for your veins. Like, this was my nutrition learning, that teaching. Like, I think we could have done way better.
Yeah. Here's Kim says, do you have any idea what would cause sudden gout in a husband who's been eating primarily plant-based? See, that primarily, mostly, those are all like, why doesn't he go why doesn't he go all plant-based and see if it goes away?
I mean, primarily it's better than none, right?
Right. No, exactly. But I mean, like, for me, like, the obvious thing would be, okay, now go all plant-based and see if it goes away.
Yeah, absolutely. I agree. I think you can try that. There's also the fact that there can be like some kidney issues, like, right? Like, we don't hear, like, gout flare is going to be usually triggered either by a really like heavy meal rich in, again, a lot of purine. So it's usually not plant. And then, well, like some patients, if they eat mushroom because it's rich in protein, they actually will trigger a gout flare. But yeah, for example, if your husband has recently started a diuretic, that will do that. or if there has been a stress in his life, that will do that. Or maybe there was a trauma on his foot that will do that. So there's like so many reasons why you can develop a flare of gout. And if it's just one flare, by the way, we don't necessarily treat other than treat the flare. We don't necessarily need to decrease the uric acid because we think just one flare is probably enough, as long as the uric acid is not too high.